Welcome everybody to the HealthNet Canopy Health Product Update webinar. We are so excited you're with us today. We are going to launch with a special message from Jen Moore, who is the Commercial Officer at HealthNet, to share her thoughts on why this product offering with CanopyCare is so important to you and your clients. Jen?
Thanks so much, Denise. I'm happy to be here with you today. I am Jen Moore. I'm the Commercial Officer at HealthNet. I've been in this role for about 4 years, and I have responsibility for sales, account management, strategy, and product planning for individual, small group, and large group products across the state of California. I've been with HealthNet about 20 years. I spent a good chunk of that time in our IT organization leading system integration work across many different platforms. So I'm really excited to bring that background to this work with Canopy, because we spend a lot of time talking about innovation, technology, digital integration, etc. So thrilled to be here today to talk about our partnership with Canopy in a little bit more detail, and specifically about CanopyCare.
Thanks everyone for joining us and for Jen kicking us off here. I'm Denise Vance Rodriguez with Canopy Health, and I'm the Vice President of Business Development. And I am so excited to be here with our partners at HealthNet for the launch of CanopyCare HMO. We'll start with our agenda. First, I'm going to introduce myself to you in just a moment, but I'm also going to be introducing our guests from HealthNet. Really excited to have the HealthNet team with us to share this information and focus on how you will be able to present this material to your clients in a way that's easy for them to understand and see the value proposition. With that, I'll kick in and give you just a little highlight of myself. So as I mentioned, I am the Vice President of Business Development for Canopy Health. I have been with Canopy Health for 3 years, so pre-launch into the commercial space, and very excited. It feels like 3 years feels like 15 here. We joke because we're in such a startup mode, but we have so many exciting, innovative things going on here at Canopy Health, and really excited to share those. My background really is pretty diverse. I have 35 years in the health insurance space, doing anything from working on the insurance carrier side and underwriting, to consulting, to doing some population health management, consulting, and most recently, really working with providers and helping launch programs like Canopy Health. With that, I'd like to introduce our guest to you today. First, we have Tammy Tucker. Tammy is the Senior Vice President of Commercial Sales. She has a broad background with not only HealthNet, but she's led 3 business segments, including IFP. She leads the 3 business segments, including IFP, small business, group, and large group, representing $4 billion in annual revenue. And I don't know when Tammy actually sleeps, but I know that working with her and her team has been a lot of fun, and her energy around this product is just amazing. And with that, she brings over 30 years of managed care experience in the California market. So very excited to have Tammy with us today. Additionally, we have Bill Thomas, who is the Vice President of Broker Experience. Bill spearheads HealthNet's expanded broker experience team and capability, which supports all lines of its commercial business. He has more than 25 years of experience in employee benefits consulting and health plan sales management. He has an extensive knowledge of the benefits marketplace and maintains numerous close broker relationships. And finally, we have Ray Gallagher, who is Vice President of Sales, Large and National Accounts. As a new member of the HealthNet team, Ray's role is to help his team work with brokers and consultants to meet their goals of their clients. With his diverse background as a broker, most recently at Willis Towers Watson, Ray brings 25 years as an employee benefit consultant and health plan sales leader to his role. And with that, I am going to go to the next slide and turn it over to Tammy. Tammy, welcome.
Good morning, everyone. Can you hear me, Denise?
Yes, we can, Tammy.
All right.
Thanks for joining.
Thank you. Well, it's so wonderful to be back at HealthNet. This is my second tour of duty, and in reviewing the attendee list today, I recognize so many of your names, and my old friends are the best friends. So I'm so happy to be leading the commercial sales organization for HealthNet again. And what I'd like to do is cover HealthNet's market factors and network strategy, kind of as an explanation of what we've been up to, what we're doing, and then I'll turn it back over to Denise to talk about our launch for large group, 101 plus employees, CanopyCare HMO product. Next slide. So first, let's talk about what's been happening in California and across the country. Market factors are driving what will be impactful changes next year. 2021 medical cost, the actuaries are saying will range from a trend of 4 to 10% in California, driven by COVID-19, including predictions that non-emergent procedures and elective surgeries will return, telehealth will go mainstream, mental health, as you've probably noticed, is exploding in terms of demand. Networks will narrow out of necessity, and that's an area we have a lot of expertise in. New specialty drugs and, of course, vaccines will add cost as well. So there'll be contributing inflators as well as deflators in pricing trends next year. Next slide. So what's wrong with just having PPO plans and Kaiser in the Bay Area? There's nothing wrong with it. However, employers are really looking for an alternative to Kaiser. Kaiser has about 60% penetration in the Bay Area. There are broad network PPOs available. However, they're expensive. They're a fragmented system of care. They lack the managed care controls that your clients depend on, no primary care. And the member experience is uneven, and employers are looking for another option. Next slide. So HealthNet is really positioned to return to the Bay Area in a big way. We're the largest network model HMO in California with over 2.5 million members, about 700,000 members in our commercial lines of business. We have over 100,000 members in Medicare and Medicare Advantage. And then, of course, 1.74 million members in our Medi-Cal plans. So these three lines of business really make it possible for us to understand the delivery systems in a really deep way. And what we know is that the Bay Area needs an accessible, affordable, and accountable HMO program. Next slide. So what is HealthNet's strategy? Our strategy is to really enforce accessibility, affordability, and accountability. And our current state of network contracting, 40 years ago, health plans were really focused on reimbursing providers from a fee-for-service perspective. We moved into the shared risk and dual risk markets 40 years ago, and today have global risk arrangements with our multi-specialty medical groups who are at risk for both the professional services and claims as well as the hospital services. Our arrangement with Canopy Health is a global risk arrangement, but we've moved into more of a strategic provider partnership to drive more accountability around performance metrics, quality, member satisfaction, care coordination, and cost of care controls for both medical and pharmacy. Next slide. So when you're looking at HealthNet, what you're looking at here is an axis of price on the left, access along the bottom. It's kind of faint, you can hardly see that. But what you see is a myriad of networks that are available to large groups with 100 or more employees, ranging from the narrowest of networks, our Salud network, which is a cross-border product. We've put CanopyCare in next as our Northern California, Bay Area, 9-county HMO product, new product that will be available effective for January 1, 2021 with 5,000 physicians. Denise will tell you more about that. And then you can see our other networks that are described going up the up the line all the way to our full PPO network, which is available in California. Next slide. So with that, I'm going to be available for Q&A near the end of the presentation, but I'll turn it back over to Denise to introduce Canopy Health and our CanopyCare HMO.
Thanks, Tammy, and wonderful job giving a great overview of the market environment, but also, the positioning of CanopyCare in the market. So we're very excited about that. Next slide, please. So one of the biggest questions I always get is, what is different about Canopy Health? And people like to put Canopy Health in an ACO bucket. In reality, Canopy Health is an accountable care network, and really born out of the idea that we have to do something different in the Bay Area, or the prices for healthcare are going to continue to escalate and become unaffordable for consumers. And also really combine that with innovation. So knowing that we are an accountable care network, we're working together in the Bay Area, yet we remain independent. So unlike other organizations that are one provider specifically owned, Canopy Health is an organization where we invite independent organizations like John Muir Health, Hill Physicians, Santa Clara County IPA, Meritage Medical Networks, and Dignity Health Medical Network to start working together to bring physicians together to work together across the Bay Area. We offer a high quality, affordable healthcare through our alliance, and we believe our patients should have a voice or an active role in their care. In many HMO models, the model really is about the doctor saying, you're going to go here for this, or you're going to go here for that. We don't believe that members should have an active role in their care model, which means that if you go in and you've done your research and you know that Dr. Smith down the road is the person you want to have to do or your orthopedic surgery because all of your friends and family have used Dr. Smith, he is in network, you can have that conversation with your doctor and decide where the best and most appropriate care is, because we do believe that members need to be engaged in their care to be an effective physician. Our alliance partners actively contribute to our governance of operations. This includes participating in financial performance of the plan. And ultimately, Canopy Health's mission is to improve member health and facilitate partner growth through an affordable and well-integrated collaboration of independent healthcare organizations. Next slide. How are we innovating care? This is always a really big question for the Bay, right? And so if you think about the care model today, under an HMO, everything lives with the insurance company. Canopy Health said, no, we want to do things differently. We want to allow our providers to really manage the care. But we don't want to be a full-fledged insurance company because we believe that our partner HealthNet does things really well. They do the administration, they do the eligibility, they do behavioral health, they do the retail prescription drugs really well and the enrollment. What we do really well is managing that care. So with the guidance of the primary care physician, our model is really to help the member get the best care in the right setting at the right time. Some of our programs include transitions of care. What that means is once a member is admitted to an emergency room or a hospital, we get a notification. We're then able to reach out to that Canopy Health member's primary care group and say, hey, did you know Sally Smith is in this emergency room? And start coordinating care right at the beginning of when that happens. Our care alerts come to our nurses in Canopy Health operations literally within 10 seconds of that patient being admitted. So now imagine you have an advocate on your side who's helping to manage that care. We have amazing stories of how we've been able to repatriate information back to other partners within our network and really help with that. We have our Care Management Council. Our Care Management Council is really a subject matter expert group, and they are really built around strategic and operational oversight. They create, implement, oversee, and enhance the care management activities. So what they really do is bring all of our partners together. So on our Care Management Council, all of the partners that are part of Canopy Health get together on a quarterly basis, probably more like what we're doing today in Zoom, right, in this environment, but they are still connecting and sharing information on how they can better manage their cases. It's a great way. So now you have all of these, what would have been competing organizations, really starting to work together to manage care in a much different way. Our Physician Executive Council, the charter really is to bring together our physician leaders from across our alliance partners. And they're out there to further improve our collective performance and foundational elements. So they're sharing data, they're developing performance metrics around quality, service, access, and the total cost of care. Those are the great things that those councils are doing. And those are just two of the councils that we have. We have a Quality and Improvement Council at Canopy Health too with our providers. We're building out a dedicated member service center for the new CanopyCare members we're going to be getting. And then also the health and data analytics and how we're taking a look at our members and really drilling down into those conditions to get to a point where we're able to really manage them. Next slide, please. So why do the alliance partners care? Well, it's a great question, right? And I think Tammy touched on this really well when she started talking about the market. Kaiser continues to gain commercial market share, not only in the commercial, but the Medicare Advantage market share. They own 60% of the market. So when brokers tell me that that Northern California is a PPO market, I just kind of giggle because I'm like, it can't be a PPO market because the Kaiser has 60% of it. And it's 60% in a passive model where members really don't have a lot of choice on where they're going to go to get specialty care. They're told where to go. So having a voice in that type of environment is really difficult. And I don't want to make it sound like I'm bashing Kaiser because that's certainly not my role. Really, it is about people who want to have an active role in their care. This is the type of product that they would want to have. I know personally, my husband does not like to have an active role in his care. He doesn't want to have to think about what to do. So from that perspective, what he does, for him, the Kaiser model would be great. Now, I won't let him do that because he's my husband, but that's okay. And then you have people like Southern Health that have emerged as a low-cost threat. And again, you're really in one system. You don't have the ability to seek care outside of this other system. And that's not a bad model, but it's just a different model that's emerging. And employers have constantly come to us, and I still get calls from employers to say, we need an alternative to Sutter and Kaiser in the market. We really want different products, and we really want competition in Northern California. And obviously, purchasers want the collaboration. So think about the breakdown in a model today. In a PPO environment, there is no primary care physician really guiding and directing that care. It doesn't happen. And the sharing of information that happens across the Canopy Health Network with our Care Management Council and our Physician Executive Council, those are really great experiences for everyone. And then also the fact that customers want a better member experience. They don't want to end up at a call center that doesn't know their benefits, that doesn't know the value adds that come with the network. They want to really feel special, and they want an answer. I know, I think that when I call a customer service number for maybe it's, my washing machine or something, I get frustrated when I get bounced around to 3 other numbers and I can't get what I need. And we're really trying to make that member experience very unique. Next slide, please. And if you think about where we started in the Canopy Health product portfolio, I am so excited the fact that we started with HealthNet. We really launched Canopy Health with our partnership with HealthNet with a product in UC Blue and Gold. So they were the first out the gates. We really worked with them to really manage and learn and grow. They were great partners because they really helped us build the plane as we were just getting off the ground and launching. So we've had a lot of experience with HealthNet and launching into a market. We then expanded to SmartCare, which, as most of you know, is pretty much predominantly our CalPERS product. It is large group or 100+. And in flight, we're still building that plane. We're adding more seats. we've got CanopyCare for large group, which is 100 plus. Next slide, please. So with that, CanopyCare, which is still pending Department of Managed Healthcare approval, will have 15 plan designs, and they'll still maintain defined contributions, so you still have plenty of choice for your clients. There'll be savings with a 2-year rate cap. Access, we've talked about our network. I think you'd almost have to be living under a rock to not have heard about Canopy Health and our amazing network. I know I'm probably the biggest cheerleader, and I left my pom-poms at home, but we do have 5,000 physicians across the Bay and 20 contracted hospitals with 48 urgent care centers. There is so much depth to our network. We are the only network that has a contract with Zuckerberg San Francisco General. Right now it's limited to OBGYN services, but we have more hospitals in our network than other narrow HMO networks. And engagement, you know, the Alliance Referral Program and that seamless referral that John Muir Health can do to UCSF or Hill Physicians or Dignity or Skip It at Dignity, that's the seamless part of it. We're really allowing the primary care physician to manage the care with the patient and really do the referral where it fits in the member's life. And then also innovation. I'm really excited to get to the next slide because I'm going to talk about how we're really innovating around the whole digital experience. So as we go forward to that next slide, that's the next one. I guess I'm jumping ahead. I'm going to show you the service area first. So those 20 hospitals and 5,000 physicians are really in a 9-county area. And that means we have Southern Sonoma is a partial county for us. And also Solano, we go only to Vallejo. But outside of that, we have Alameda, Contra Costa, Marin, San Francisco, San Mateo. The majority of Santa Clara County is a network. We kind of fall off around Morgan Hill, Gilroy, but for the majority of it, we're in that network. And again, we talked about the partial networks for Sonoma and Solano. Next slide, please. And here's the digital experience. I get so excited. I'm going to walk you through the next phase of our digital engagement and how we're really innovating in this space. So today, a Canopy Health member can download the Canopy Health app and also set up their login in the member portal. What that does, it allows them to do a single click on the virtual visits within our system. So in most environments, there is a click to a virtual visit or a telehealth visit. But what it does is it takes you out of that environment and sends you to another website. We decided we wanted this to be really easy for our members. So we took more time building out our virtual visits, and we embedded that experience into our environment. So when you click on a virtual visit within the Canopy Health environment, you don't leave. You stay in the Canopy Health environment, you do all your information in that environment, and then you have your video visit with your provider in that environment. After your video visit is done, unless you specifically say that you don't want those notes to go back to your primary care physician, they automatically go back to your primary care physician. And then the member is able to go in and pick up RX from the pharmacy. They can go pick up their first prescription, maybe that the doctor prescribed, but they can go in online, and we're launching with John Muir Health as our first pilot to bring in all the abilities that you can have with your physician group. So now you're able, if you have a John Muir Health doctor, to schedule a follow-up visit, to look at your test results, to communicate with your provider. You also have the ability to see all of your carrier information as well. So we'll have the link where you can get your digital ID card online. You'll be able to look at your plan design. So there's so much there that you can do. So what we've really done is we're marrying all of the information that comes from the insurance company with your provider into now one really seamless experience. And really, what's next? There's so much more that's coming with Canopy Health. We've seen membership growth. We're going to grow our network. We're going to continue to develop out those systems of care and look at where it makes sense to really evolve and grow in that space. And the member experience was one of the things that was really critical as we launched and continues to be critical. And then as we evolve telehealth, ideally we want to bring in the information and allow our physicians to be part of that telehealth experience. So instead of using some doctor at a service, we'll be able to actually marry those together. So watch for us in the next couple of years and see how that grows and expands. We're very excited about it. Next slide, please. So the value proposition for your clients is really this. It's an alternative to Kaiser. We're not saying that we're the end-all be-all, but we're saying it's an alternative. There are options. It's a high-value network. If you look at John Muir Health and UCSF and Hill Physicians and Dignity and SCIPA and Meritage and all the awards that they've won, we have a whole deck on just the awards our partners have won. And it's great because it's that high-value care that you're looking for. We're doing the clinical innovation. So now we are really bringing all of these independent providers together to start sharing information and really pioneering scientific innovation across the way, and a better member experience. So we're really working on that. Everything is really growing and really working towards a better member experience, and really in an HMO environment, having members with a primary care physician who's really going to be their health champion and helping them navigate the healthcare system. And with that, I believe we'll be turning this over to Bill Thomas. Bill.
Righty. Good morning, everybody. How's everybody doing? I hope everybody's doing well. Listen, I want to talk about some programs that HealthNet has put together to facilitate the launch of this product. We're super excited about the HealthNet Canopy partnership, and specifically the CanopyCare product. Just when you look at the marketplace, the market is in need of something like this, so we're super excited about it. When you take a look at what's going on, in order to facilitate the launch of this product, we're talking about doing a few things. One, we're looking to recognize those GAs when the GA is involved. And again, we're talking about large group sales. If there's a GA involved, we're looking to pay a $35 one-time per member bonus.
Hey, Bill, you need to advance the slide.
Oh.
There you go.
There we go. Thank you. Thank you. Sorry about that. Going back, again, we're paying a $35 new member bonus for the GA, one-time bonus. And then on top of that, for each new member, we're paying the broker a $100 new member bonus, one-time bonus for large group sales. This is on top of the already 4% commission load that is there. So this program is extremely lucrative. It's exciting. It's something that I think will encourage this product to become a real exciting boom within the marketplace. And we're just really happy to be a part of this partnership and looking forward to working with you all to bring this to your employers. So thank you. And I think it's time to pass this off to Ray Gallagher.
Good morning, everybody. Hopefully, it looks like everybody hears me. Again, Ray Gallagher, and I am the Vice President of
Ray, we're having trouble hearing you. You're going to have to speak louder.
Okay, hi, this is Ray Gallagher. Is that any better?
No.
Okay. Okay, so I'm just I'll start yelling at you guys. It's my children understand that. So, hey, Ray Gallagher, I'm, large account sales, that's 101 plus, which is also where the Canopy product offering begins. So this product, again, is for 101 eligible employees. Let's go advance to the next slide, please. And, before I kind of start, if you haven't quoted with HealthNet in a while, you're in for a treat. About a year ago, I think that our proposal process was characterized by being a little slow from a turnaround perspective with a high ratio of decline to quotes. That has been cleaned up dramatically. We have an internal standard of turning stuff around within 10 days, but we're doing it right now in less than half that time. And we've also reduced the number of declines to quotes by about 80%. So we're looking for business, and this is a great opportunity that helps us get there. To get a quote's really easy. provide your Health Net representative with the following information: census, claim experience, and large claim information. If you don't know who your Health Net representative is, my contact information is at the end of this presentation, or even easier, just email the prospect to this address, canopycare-quote@healthnet.com, and we will turn it around for you, as well as introduce you to the person who's going to be supporting you. We will support client meetings presently on a Zoom basis, broker firm specific webinars. We want to be in front of your teams, right now virtually, but look forward to getting together in person as soon as that can happen. And again, keep your eye on the CanopyCare LinkedIn page to learn about our upcoming events. Please advance. So we have, and in the appendix of the deck that we'll be distributing, you'll see the plan options. We have 15 different plan designs filed, and these really represent the full range of plan values, from kind of the leanest plans with high point of service cost sharing to plans that really kind of bump up against 100% actuarial value. So it really doesn't matter what plan you have in place today. If we can't match it exactly, we can give you a plan of similar, if not the same, actuarial value. And then again, that streamlined quoting process, again, we're getting stuff out quickly, and we're responsive as we need to be from a competitive standpoint. So again, look forward to working with you on that. Could you advance the slide one more? Competitive pricing. I'm going to go off script a little bit because we've been doing this for about 10 days, and the pricing is nothing short of amazing. We are, in some cases, really just blowing the doors off the incumbents, and excited to see how that evolves. Again, with the comprehensive benefits, and this is all coupled with really a high value network. So this is really kind of anomalous where you get this kind of pricing with that kind of access. And again, as we've talked about some of the digital tools that are available, it really is such a high touch, amazing member experience. So again, looking forward to quoting this and selling this. And I think I'm able to transition it back now to, if you advance the slide, I think we're going to our Q&A.
Thank you, everyone. This is Denise again, and I know we've had a lot of chatter. It's so exciting. Tammy's been out there answering all your questions, and great to see that. But we're going to open it up for Q&A now. So if you have any questions, please feel free to use the Q&A function on your bar, and we'll start answering your questions. So one of the questions that's coming in is, what's the minimum participation requirement? So I'm going to turn that over to the Health Net team. Maybe Ray can answer that.
Well, I think Tammy was right about the answer, so I'll let Tammy answer it because it is a nuanced response.
Do you want me to write it or just say it? I'm fine to just speak to it.
I would just go ahead and speak to it.
Yeah. Most carriers have really strict minimum participation requirements, especially when writing slice business alongside Kaiser. We've relaxed our participation requirements alongside Kaiser to 20%. Ray, keep me honest here. Secondly, we've got a list of minimum participation requirements for total takeover cases that we can send out to all the attendees after the meeting as a follow-up. We have all of your emails. So we can send you the underwriting requirements because many of your questions were related to underwriting and participation requirements. So we have two different participation requirements, one alongside Kaiser, which have been relaxed, and two for total takeover cases. Ray, do you know what that percentage is? Is it 30?
It's 30%.
30%, yes.
But I think your idea is a good one because, again, we really want to play in slice situations on full takeover or even as a local option to a national plan. So it's really going to be a really nuanced response. And we also can work with you for the right kind of opportunities. So again, we'll send out the requirements to everybody who's participating, but the best way to see what it is just throw it, send it into the inbox. We'll either turn around a price or we'll help you understand where the right fit is and are ready to support you.
Thank you both. So one of the other questions coming in is, can we get help with prospecting for leads? So I'll let the HealthNet team answer that question as well.
Ray, do you want to try addressing that one?
Sorry, I'm having my speaker kind of just went out for a second. So if you can repeat it just really quickly, and I apologize because I caught about half that question.
Yeah.
That's okay.
The question is, will we help the brokers and GAs with leads?
Again, I'd say the first thing, especially, if you want that kind of support, and we would love to do that. Our team is fully trained on MyEdge and can really work with you on how to target those kind of opportunities that are going to represent a great fit, whether where they're sitting currently with an incumbent or whether they're the kind of industry and the kind of geographic footprint that's really going to make a lot of sense. So excited to kind of get together with everybody here who's listening and really kind of be strategic, not only about your existing block, but also let's go write some business together.
Thanks, Ray. So there's a question of asking if Canopy will be available for Southern California. We would love to be in Southern California, but we got to get Northern California right first. So as of right now, we'll be only in Northern California, and who knows, maybe what the future holds. We obviously are innovating, but right now we're a Northern California product. Let's see.
Ray, do you want to explain what MyEdge is?
Oh, yeah.
The database?
Yeah, I apologize for that. I don't mean to be too inside baseball. MyEdge is a 5,500 database that has information, and it's a tool that I think a lot of organizations use. And it's a tool that basically can tell you if you know the prospect's name, really, what their current offerings are. You can even kind of back into what their premium is per employee. So it's a pretty good tool. But listen, I mean, you don't have to subscribe to that. Just again, reach out to me. I'll get you connected with a member of our HealthNet sales team, talk about the kind of business that you want to pursue, and we'll help you find that.
Hey, Tammy, there's a note here. Do you want to go ahead and take that one from Don?
Let's see, are you having a quarterly meeting? Is that the question?
Know about the employees who reside outside of the Canopy network, how you'll be able to offer different options.
All right, so let's see. So the question is, what do we do for employer customers who have employees residing outside of the 9-county area? If you think about the presentation and the slide that had multiple networks on a grid, you can offer CanopyCare HMO in the Bay Area, and then you can offer another of our networks in the other areas where the population is domiciled. So for instance, Smart Care is a statewide product, about 65% of our network. Excel Care is about 85% of our network. If you're looking for a facility deductible HMO, we have an EOA deductible plan that is our full HMO network, excluding UCLA. So you can plug and play multiple networks so that you provide good broad coverage for your customers' populations who reside in California. And then if they reside outside of California, we have access to First Health, a national PPO network that we can quote. So we can cover all of the employees who reside in multiple areas by combining in a dual option way or in a multi-option way CanopyCare alongside other networks. Another question, are you having quarterly meetings or just once a year? The answer is twofold. One, for GAs, we have quarterly business review meetings every 4 months. Two, if your firm or you are interested in having us conduct an update, a HealthNet update webinar for your entire producer team or your client team, we can actually conduct business reviews or quarterly updates for you, firm specific, that are customized to each of your firms. So this is kind of a broad, statewide first webinar to launch the announcement of CanopyCare, but we would be available. All you have to do is email us and we'll get someone to conduct a webinar for you and for your team that's customized just for your firm.
Thanks, Tammy.
Yep.
There is a question that came in about our capitation arrangements. And so the way the contract works for CanopyCare is Canopy Health holds the provider contracts and the hospital contracts, and then we contract with HealthNet for that. So those capitation arrangements are actually held by Canopy Health. Obviously, we're not going to give you the secret sauce behind them all, but they're capitation arrangements. So within that, our providers take risk, both up and downside risk. So they are, and they own Canopy Health. So for Canopy Health is predominantly owned by John Muir Health, Hill Physicians, UCSF, and most recently, John Muir Health Physician Group. So those are our predominant owners. And that's kind of the way we work. So hopefully that gave you a little more insight to the capitation arrangements. There's a couple of questions in here, Tammy, around wellness programs. Can you speak to that?
Yes, so we have an extensive list of wellness programs, most of which are no charge. So after this meeting, what I'll do is work with Denise to push out a copy of today's presentation, secondly, a list of our underwriting guidelines, and then thirdly, a list of our wellness programs, most of which are no charge, that can be made available to you, including customized worksite wellness programs for your employers.
Yeah, and to add on to that, one of the value adds of having Canopy Health as part of this offering is we're able to engage our alliance partners if you want to do on-site lectures and things like that. So we're always available for that.
You know, there's, let me just say something else. There's a lot of interest in lead generation. And in speaking with our new Vice President of Small Group, Chris Patton, who I recruited from Kaiser, he was on a webinar last week and got a lot of feedback from small and mid-sized brokers who were saying there are pockets of businesses who are really killing it right now, really doing well. COVID has kind of put a pall on new business selling. Retention has really kind of increased. People haven't been making a lot of change, but there are some industries, guys, that are actually growing or that are doing really well during this difficult time. So, maybe we ought to think a little harder about how we identify businesses that are doing well, industries that are doing well, and communicate more regularly with you in a way that helps you to sell new business, sell new customers, and grow your businesses.
Thanks, Tammy. There's a couple more questions that have come in. So one is around a triple option, if CanopyCare is offered around triple option. And then I'll let the HealthNet team advise whether they'll be able to write a cannabis group.
Let's see. Okay, I'll take the cannabis group first. I don't know. I'll have to check the underwriting guidelines. Secondly, it's our preference not to write alongside Sutter. It would be our preference to write CanopyCare and Kaiser only. However, if Sacramento can be walled off, you know, let's take a look at it. You know, never say never. Let's take it to underwriting and see what the enrollment mix assumptions would be. Let's take a look at it, Connor.
Hey, Tammy, there's another question from Steve regarding if groups can join together to get to 100 plus. I know there's a lot of legal guidance around that.
Yeah. Yeah, let me address that. The DMHC recently came out with a new all plan letter making association health plan business illegal or not qualified effective this fall. So, you know, for instance, Bill was working on a big association where the association wanted to write a bunch of smaller businesses to join an association to get access to large group pricing. The DMHC will disallow that this fall. So what we've done is said, okay, one, we can still write PEOs. Two, our small group team is going to be targeting association health plan groups out there to see if we can offer competitive and affordable narrow network or full network small groups to these businesses who were previously buying their insurance through an association health plan. I don't know if you've heard about it, but it's something that kind of rocked us this spring as we were getting ready to roll out a new association client.
Thanks, Tammy. And then there's a question that asked if CanopyCare is only an HMO, but if there's a PPO option, and the answer to that is it's an HMO. It's only an HMO option.
Right, but we do have health net PPO options that are available. So you could offer CanopyCare HMO in a dual option way alongside the PPO. And my underwriting advice would be to really understand the enrollment mix assumptions that you want to use in pricing the HMO alongside the PPO. So for instance, if you think 25% of the group will enroll in the PPO and 75% will enroll in the HMO, you'll get a much more competitive priced total package.
Thanks, Tammy. I know we have a couple minutes left here. If anybody else wants to ask any additional questions, we're really glad you joined. I'd like to advance the slide one more, and this will give you the contact information. Again, we'll share this out with everyone that joined us today, and even those who were not able to make it. I know that these times, there's no technology that everyone's going to be able to log into, so we certainly apologize. We try to make it as easy and convenient for everyone as we can, but I know there are some limitations. It looks like we might have one last question coming in. Yes, can broker commission be negotiated to 5%? So I'll let the HealthNet team take that.
Yes, the answer is yes. The 4% is what's standardly included in the large group pricing. However, if you want to negotiate a higher commission rate, 5% or 6%, you would just negotiate that with your sales representative or through Ray.
Wonderful. So you can see these contacts here. The HealthNet team has hit the ground running. I know I've been getting a lot of requests for some RFP activity. So I think, Tammy, the last thing, if you'd leave us with the illustrative quotes process that's going on right now, maybe just touch on that for just a second.
Sure. So we are available today to release a quote, and you'll see in our proposals a disclaimer on the rates at the bottom that says pending DMHC regulatory approval. That's just a de facto standard process that we go through while we await the DMHC to give us final product approval, which we expect any day now. We expect that by the first week in September or so, the DMHC will approve all of our filings, and we'll be off to the races. But don't be surprised when you receive a quote that it will have a little disclaimer pending DMHC regulatory approval.
Thanks, Tammy.
And
I want to thank all of our health.
honest.
I want to thank all of our HealthNet guests. I know it's a busy time of year for everyone, so I do want to really thank all who have attended today. If you have any questions, you can send them over to Canopy Health, or again, you can reach out to your HealthNet team. If you need assistance or you have anything else you want to ask or questions, please don't hesitate to reach out, and we're here to help you. And we are so excited to be growing CanopyCare in the Bay Area. So thanks everyone for joining today. Have a great day.
Thanks, everybody.